Good morning, good afternoon, wherever you are in the world. Thanks for joining. Welcome to today's topic, which is cybersecurity at GE Healthcare. My name is Olaf von Wackerbarth. I'm the Information Security Officer for EMEA, which means I cover cybersecurity for the 112 countries in Europe, Middle East, Africa, including Russia. Well, my experience in IT, I started with IT about 35 years ago, roughly, with the Commodore 64, so quite a little bit of experience. Joined GE in 1998, and since 10 years I'm in GE Healthcare in the international management. Since 5 to 6 years I'm covering cybersecurity for this 112 countries in this region. You can imagine this mix of countries creates a colorful landscape of cybersecurity, which creates sometimes very interesting challenges. And that's a good keyword to jump into our topic, cybersecurity. Cybersecurity today, it's something, well, everyone knows it, right? But let's look 10 years back. 10 years back, it was more like I would say, hygiene factor. There were a couple of guys who were aware about what is possible with the internet, what a cyber attack means. We all remember probably on the Stuxnet attack in Israel, not in Israel, but it was in the Middle East area. But it was more a hygiene factor, right? And the hygiene factor, when you compare it, for example, to a restaurant, is imagine you have a fantastic restaurant, but the toilet is probably not the best. That's a hygiene factor because you wouldn't go there again. But you would never go to a restaurant just because the toilet is very good, right? So that's the opposite. Well, that's 10 years ago. Then a couple of things happened. We all remember the WannaCry crisis in the UK, NHS, more than 20,000 surgeries, operations, and examinations had to be postponed, massive patient impact, and the world woke up. Well, one thing happened in 2016, which was GDPR, and all the companies had 2 years' time to implement all the controls and security framework that's needed to be compliant with GDPR. That was an interesting time because especially for a global player and especially for a company in a critical infrastructure environment, and this is where the healthcare business is located, it was time to think about investment. And what I would like to show you is what we did in this time and what it means today. So let's jump to today. Where were we today? Today, cybersecurity, it's no longer a hygiene factor, it's a business enabler, definitely. It is very clearly a kind of competitive disadvantage if you are not good in cybersecurity. Why? Well, today's world is much faster than the world 10 years ago, right? The expectation is that, especially when you think about medical devices, that we know problems and issues of a medical device before they appear, which means you need a kind of proactive services, or you need to have, when you think about a reactive service, you need to be able to react within hours. And I'm not speaking about 10 hours, I speak about 1 or 2 hours to know the problem, to have a spare part if needed on the way, to understand what's happening with the device, to understand the issue, and to have a solution. So the world became much faster. But to get to this point, there was just one way, which is digitize your service. And when you speak about digitization, you need to have a connection to a medical device as a service provider. You need to have the data of a device. You need to have access to it. This automatically means when you speak about connection and data, cybersecurity. It's one of the key elements that you need to manage as a service provider and as a vendor to make sure that you are up to date and state of the art. Now, there are still people who think cybersecurity is not an important thing. Now let's look here. These are numbers from 2018. 80% of the hospitals faced a cyber attack. 3.86 million average cost of a data breach, and that's just 2018. We are now in 2020. And I can promise you, as long as we know the data in 2020, which will be probably in 6 to 12 months, this number will be increased dramatically. Look further, 4.7 billion just in the US, right? Just in the US. That's incredible numbers. And when we look in Germany with the latest cases, which, for example, is the University Hospital in Düsseldorf, which was in the news, and a patient died, there was a very clear impact on patient health. So cybersecurity is a business enabler nowadays from our standpoint. And that's why we started to invest a lot of money a couple of years ago, because 5 years ago, we clearly understood that we need to invest and think about not just a GDPR compliant solution, but also something that creates real technical, operational information security for our customers. So what does it mean? It has two levels. Let's have a look on the first, so to say, on the basement. When we think about cybersecurity, there were always two words. It's cybersecurity, which is the operational implementation of security controls. That's how I see it. And there is the data privacy world, which is the world of the regulations coming from regulators, from governments, etc. Now, since GDPR, there's a very clear overlap. Think about the Article 30, 32, which says that you have to implement security controls that are state of the art, right? So there was a clear overlap now, and there is a regulatory need to have a good cybersecurity implementation to be compliant. But it's not just this one. Well, when we look a few weeks back, the European Court of Justice invalidated the Privacy Shield. There was also a legal component, and that's something that's very important. Now, why is this important for you? Well, today's medical devices and medical technology is so complex. Think about the big sockets like CTs, MRs, but also think about those devices which are mainly based on software, artificial intelligence. These are multi-million-dollar investments. And I do not speak about one or two. I speak about $10 to $100 million, if not more. So those investments needs to be, well, they need to be done, right? Which means you typically speak about global player. Well, global player means they're spread over the world. Typically, you have engineering and knowledge everywhere in the world. But this also means that the data that is needed to provide a service needs to be transferred to these people who can provide the service and do have the knowledge. So Europe is a big part of the world, but it's not the entire world. So we automatically speak about data transfer, and that's something that's valid for every global player that's operating in the medical device business. So what do we have there? Three elements, or three solutions, right? The so-called model clause agreements, the so-called privacy shield, and finally, the binding corporate rules for data processors, not just for data controllers. What it means, well, from left to right, it simply becomes more complex to implement. A privacy shield is the most easiest solution. This has been invalidated by the European Court of Justice. We are no longer allowed to use it. That was very simple to achieve, right? The model clause agreement is something that you have to negotiate with every customer. So a lot of work, right? But those model clause agreements have also been invalidated with the decision of the European Court of Justice. The final thing, the binding corporate rules with processors, means that a company gets in negotiation with every data protection authority of every country in Europe and is finally responsible for the data protection. And there were it's a very low number of companies that are really certified by BCRP in Europe. And I'm happy to say that GE Healthcare is one of those companies in Europe that are certified by BCRP, and we are allowed and have a working legal mechanism to transfer data out of the EU. the list of companies that are enabled to do so by using BCRP is very, very low, and I really recommend to check it on the web pages of the European Commission. That's the legal fundament. The next level on top is, where do you process your data? Why is it important? It's always a question of which law are you able, you as our customers, are you able to apply? And I think every global player, every company nowadays needs to think about having their data processing and data storage within the European Union, so that you can apply European law. So that's something what we did. All our remote service applications, everything that's touching your data is stored and processed in the EU. And that's a very important thing, which means for you that you have you are in a very comfortable situation to be sure that you can apply European law. And the last thing is about, when you have all this legal fundament and all this data processing or this localized data processing in the EU, what do you do with the data? What do we do to protect you and your data? And there was, to my knowledge, and that's my opinion, there was just one solution that's really, really professional, that's the international gold standard of cybersecurity. That's an information security management system that is certified by ISO 27001. But be careful. An ISO 27001 certification is finally just a piece of paper. The information security management system and the certificate on top is just as good as its scope. So my opinion is that it's not enough to just cover a network, because that would just cover and protect the connection. What's about all the application? What's about the server infrastructure? What's about the vulnerability management for all this, for the application and server infrastructure? What's about the user reviews for this application that's been used to transfer the data and process it and to do remote diagnostic and all the remote services? And also, what's about the people behind that provide the service? In my opinion, and that's GE Healthcare strategy, all this needs to be covered by an information security management system and certified by ISO 27001. This is the certification that we have. We cover remote service delivery wing to wing, including the hardware or the infrastructure, the procedures and processes, the applications, and the people. For us, we think that's on top of the pyramid. It's wing to wing. And all this together builds the fundament for the next level of cybersecurity. So what does it, because, I mean, this was all very theoretical. Now let's think about, what does it mean when we follow the data stream? Now imagine this picture here. From the left side we have the hospital with the medical device. On the right side we have GE Healthcare. We have the medical device with its data stream going through the hospital network or a patient network, through a firewall, through the internet, to our firewalls, to our network, and to our applications. And then, of course, there are tons of people working with those devices, working with the data. On the left side, you create the data. On the right side, we use the data to provide service. Let's start on the left. The device, very important nowadays. We have a full product security framework in place to protect or to deliver a high level of protection on device level. This includes, of course, that we have MDS2 sheets for our medical devices, which are applicable to you. We have product security portals where we provide updates, where we provide patches, where you can see your installed base and you see our recommendations regarding patching and information security. Of course, our products have product firewalls, and depending on the product where it makes sense, we have anti-malware solution. Anti-malware and antivirus, let's spend 1 minute on this one, because Think about an antivirus solution. Well, when you have products that are based on vulnerable operation systems, that's a very important thing. Huh? Why? Well, antivirus or virus malware can easily get into those operation systems that are highly distributed in network environments. That's probably the main reason here. But a standard antivirus solution is a direct, uncontrolled connection from someone outside of your network directly into ring zero of the operation system of your medical device. If this is captured, you are lost. So, and second, you always need to update and patch. And third, those anti-malware scanning routines can impact the operation of your medical device. So therefore, you need to make sure that the anti-malware protection routines are not running or are running on a very limited level while your medical device is working. Very difficult. GE Healthcare has a strategy of whitelisting. So our anti-malware solution and our anti-malware strategy on a long term goes toward know what's running on your system and not allowing anything that's different from what we allow, or and to stop everything that's not to run on a system. So a process whitelisting solution. This does not need any updates, by the way, and is effectively doing the same than an antivirus solution. So that's our strategy here. On top, of course, we have a lot of a single point of contacts for operators directly, like our service centers, and of course we have internet contact points like our service portal. Now let's follow the data stream a little bit further. The network and the firewall, when you think about the hospital IT or let's take a patient or radiology, well, that's clearly something that is just manageable by you. Right? You have your medical IT, you have your standard IT. There were clear recommendations, for example, from the German BSI, how to set up critical infrastructure, and our advice would always be to follow them. Some good example is, for example, just in-house DNS, no external DNS. This will kill most of the encryption malware, right? Because they cannot connect to their external servers. Port security or security down on MAC address level or IP address level. So think about it as a kind of block of concrete, and then you build defined communication tunnels from every device just to those devices where you allow the data transfer. It's more complex to manage, but it's very, very safe, and I highly recommend to do so. So let's follow the data stream further. So this is where we provide service, and this is where all the elements come together that I've presented on the page before. And this is a very simplified page here, actually. And it has two elements, right? A service security framework and a legal security framework. When we think about service, we think that everything where we digitally touch your data needs to be certified by ISO 27001. This is what we have here. And of course, there will always be people and engineers coming on site, for example, to do a maintenance, to change a part. And those people, they typically don't touch your data, or just in a very limited way. They are more on the hardware side, so to say, of the service delivery. But even here, our cybersecurity strategy contains many, many elements to protect data. For example, you will never see in GE Healthcare, or at least we have the procedures in place and the solutions in place to make sure that that if we transport a device or a hard drive, we delete the data before, and we delete it in a safe and secure way, and we have solutions in place. For example, something that we call secure software secure wipe, which is a software that can boot on all of our medical devices. And also we have a hardware solution where we can secure wipe many hard drives in parallel so that every hard drive that we transport does not contain data. We also have a privacy and security standard in place that gives very clear guidance to our service organization in terms of what to do when you, for example, transport data, when you transport a hard drive, but also how to manage data retention, and we check it. We have an assurance organizations and we do audits of those controls and check if people follow those procedures and privacy and security standards. And as everything of this is ISO 27001 certified, we have a very high level of cybersecurity awareness. So there are permanent trainings and awareness sessions to remember and remind engineers what they have to do to secure their data. And all of this is based on our legal security framework, which is, of course, the Internal Data Transfer, and think about GDPR, the Data Processing Agreement. While all this was part of all those investments that I explained in the beginning, and we think that's a very it's a complex framework, but we also think it's complete, right? We think there was no element missing to protect your data. Now, let's think about reality, right? Today, as I said in the beginning, cybersecurity is a business enabler, and now I want to play a little bit also the devil's advocate. Why? Keep in mind, we all do this, of course, to protect data, but finally our objective is to protect patients' life. Now, I saw a very interesting keynote a few days ago with a very good question, which was, if you would be sick, if you would be in the shoes of your patient, how important would cybersecurity be for you? Or do you just want to be healthy? That's a good view, by the way. So let's put ourselves in the shoes of a patient. And in the end, it means it's all about risk acceptance, you know? If you think cybersecurity or data protection to an end, the final and best solution would be to not transfer any data. And what we also see is that there are hospitals thinking about this kind of solution, which means they slow down their medical service process for data protection reasons. And in the end, the patient has to pay the price. For example, in a way that a CT that could be serviced within 2 or 3 hours to get up and running in an emergency situation might need 1 day, because an engineer needs to go on site because no one is allowed to connect to a device because of cybersecurity reasons, because of risk management. Now, and I like the picture here, because think about your data flow as a bridge, right? And you see here the bridge is just 99.997% safe. I think I would swim. What I would like to do is to really think about this. How far do we go with cybersecurity? I think we have very, very good solutions in place to protect your data, to protect the connections. I also think, and it's also important for you to know, that this entire subject is something where we are going to invest further. On the other side, in the end, we finally need to meet somewhere in the middle, which means you as our customers finally need to trust us to a certain point and to accept the risk. If we don't do that, well, as I said, you can swim, right, and not use the bridge. But in the end, it's the patient who might pay the price, so be aware there might be sharks. Thank you.